Dr. Mary. Does everybody have a pen here to take notes on Dr. Mary's lesson today? Please make sure, bring your notebooks if you were.
Good morning, Cher.
Optimal wellness update. Next week, we are diving into all of our blood. So we don't need to all be in the same room to make that happen. So what I'm going to do is create a video, which is a screen share showing you guys what to do, and then give it to you. And each person on your own time will go in, will sign up as a new patient, and you'll order your blood work. You're going to do all the steps. So I'm there every step of the way, but that process is going to happen next week. So just be prepared for that. And did everybody see my note in a spot?
Yes.
Sorry to go back up. Shout outs. I have 3 shout outs. Doug, major shout out.
Shout out to Doug!
Doug is managing to just do so much for the Remedy Room with our interviewing process, development, and scorecards, while also maintaining his other job at the Remedy Room, which is our legal aid, while also maintaining his other job, which is being a lawyer for his firm, while also, being a family member. And I'm just really impressed and grateful for your time that you're committing and how seriously you're taking all of the and I really appreciate you. Thank you, Doug. Another shout out to Angelina.
Hey.
There's not been a person who hasn't, in some conversation, mentioned to me how much they love me.
That's good.
Every single person. So thank you for giving this your all. We had such a beautiful, wonderful talk yesterday, and I just love where you're at, and I cannot wait for your future here.
I'm real happy with the present.
Of course, a happy birthday to Megan yesterday. Did you have a nice evening?
So cool.
How was dinner?
We didn't go. It's kind of a bummer, but one of my boyfriend's close friends died.
Oh, God.
So we kind of like
That's it.
yesterday evening, and so we just stayed home. But we're gonna go Saturday. Okay. Yeah.
Sorry.
I know it's very sudden. It was one of those weird things.
I'm so sorry to hear that.
Megan.
Yeah, it's fun. I didn't know really well.
The third shout out is sort of the opposite of that. I want to bring a little bit of hopefully. Just a real quick update. I don't know, I think most of you guys were here in the first meeting that I held after I came back from school and talked about my mom a little bit. So an update for my mom this week. We went to all of her doctors. Her cancer screens are clear. She's lost 14 pounds, 16 pounds. She is not snoring at night anymore. Her blood pressure is normal. They're trying to take her off of the Tricor. So it's just completely, and she's so casual about it all.
Change your ways, change your life.
During all this last night, of course I have to call and be like, how did the appointments go? She's like, they said I was doing great. All these amazing things. But that is thanks to Dr. Mary. And it's thanks to the things that I've learned here. And I just, once again, I'm so grateful that I'm part of this team and that I've had the opportunity to learn with you to help the person that I love most in the world. So thank you.
I think we can all attest to how difficult it is to change parents.
Yeah.
So you can take some of that credit too, probably.
Yeah.
By the way, my parents are coming next week
Oh,
to do the
wow.
keto program.
Cool.
So
Nice.
excited to meet that.
Sorry about it. Yeah, they're gonna do the White House.
Awesome. Great.
Oh, wow. That's very exciting.
That's gonna be awesome.
Huge. Okay, the wellness consult, let's just all be on the same page. The wellness consult is a full wellness consult, which means it includes a history and physical exam and vitals. So we check them in just like any other chrono patient, and they're clear to get an IV or an injection within 12 months, given their consents are signed. If it's a virtual wellness consult, then of course we listen to their heart and lungs and do the HEP when they come in. But there was some confusion or discrepancies on that. So does everybody feel sure that the wellness consult for the supplement regimen, when they're just coming in to get recommendations on personalized supplements, that's still a wellness consult that has an HEP and clears them for IVs. Okay, great. Increase up jobs. It's really important. Is there an alarm?
It's the washer.
Oh.
Saying
Will it
switch me.
stop?
Is that what that is?
It's really important that when people are asking you for hiring, that you're not giving them somebody's email, because that means they're skipping the whole step of reading the job description. So you're sending them to the remedyroom.com careers. Okay, so it's really important that everybody is gone through that way so that they can see the posting, because if it says weekends required, then they won't apply if they don't want to work weekends, whereas what's happening now, which is our time is wasted because they apply straight to setting, we review them, meet them, and it turns out they don't want to work weekends. So, makes sense. If someone's inquiring about a job, please direct them to the page.
And then if they say they've been on the page,
That's where they apply.
They can
They
just
can
put
figure it out, yeah. They can't figure that out.
If I apply,
Yeah.
they can't figure that out.
They
got a problem.
I don't know what to tell you. Okay, we're heading into our busy season.
Yes, they may be the perfect fit.
Megan said they fit right in. They can't figure out the page.
Okay, heading into our busy season, this is a reminder, we're going to have more conversation about this. You guys decide the case, not the patients. So if we're busy beyond the point where you feel like you have control of your patients, then you need to slow down the flow. So patient care and patient experience can never, no matter what, fall through the cracks. It doesn't matter how busy you are. If that's starting to happen, it means that you need to be less busy. So you need to communicate with Caroline or the providers with the FOCA and make sure we're on the same page to slow down the appointments or call the next patient, let them know it's going to be an extra 2 minutes. So just a reminder that patient care and the quality of the experience cannot ever be compromised. So that means that you need to find a case where it's not compromised. Okay. I feel myself with the pressure to put patients in when they want to be put in all the time, and I have to remind myself this all the time. So if it comes up, don't know that you have the autonomy to call the patient and say, I need to back your appointment a little bit.
Well, and that's why Dr. Chrono is laid out, formatted the way that it is. An appointment is an hour. So when you're scheduling, make sure you give that appointment a full hour.
And Dr. Chrono is laid out to the best of our ability to reflect what we can handle, but as you guys all know very well, sometimes there are patients that chew your ear off or take a little bit more time or have an event, and so if you need to adjust the schedule, please do so.
Quick note on Dr. Chrono, finally got rid of his social security number. So
wow! That's gonna be hard to drop that.
my cousin took me on a ride over there in India. You know, Dr. Chrono.
Great. I have 3 minutes to get through the rest. Number 5, quarter 4, which is beginning right now. So our leadership team with Petra, we have our quarter 4 meeting on October 13th. So that's coming up. We're going to define our new priorities for the quarter, but as a company with everyone, we're going to all read a book together to be done by the end of the year called Unconventional Medicine. I'm obsessed with this book. I've already read it. I'm going to read it again. It's so perfect and helpful for everything that we need in terms of giving us the skills and the language to talk about a lot of things we do. So you can read it on your own pace. Don't be a procrastinator and read it all at the end of December. We are going to check in about it at every one of these meetings. So that's just your little heads up.
How many weeks do we have when we can do like X number of chapters
So
per
then
week? It's not that long of a book. It's very easy.
Yeah.
It is. You can listen to it. So if you need to get a hold of if you need to get a hold of a physical copy or an audio copy, let me know.
We have a few. From the last time.
I'm positive it's on.
Oh, awesome.
And we
Okay.
have a few on the shelf.
Yeah.
Okay, great. Caroline, can you read number 7, our honed in core values? Will you just read 1 through 6 out loud?
Live to lead it, exceed expectations, educate to enlighten and empower, get to the root, find solutions, love.
So we're adding one about love, which gets to the root of teamwork, because we removed find solutions by working together. That was trying to get at teamwork. So we're still working on the words specifically for love, but this is where we've landed after another long meeting, really honing in on our core values, and we think that this embodies what the other ones embodied, but in a much more concise way. So when we decide on the wording for love, we'll let you guys know. And one day these are going to be so set in stone that we're going to get nice printed things for the clinic, but we're getting there. So this is where we are. Okay. Okay, so now moving over to Dr. Mary, before obviously the last educational meeting we had, which must have been 2-4 weeks ago, was the IV therapy deep dive. We don't have time right now to go through some questions and quizzes from that. Hopefully you guys remember. Does everybody still feel like the information they learned from that meeting is helping them in their day-to-day?
Yes, I've been using mine.
Amazing. Okay. So Dr. Mary, before you dive into NAD, will you just give us a little note on the over-the-counter vitamin C's, because that's coming up more and more and more. Every patient's asking.
Okay, so we're
And then the
gonna
flu test.
do some social stuff on flu. We did it last year. I can't believe it's already October again. The biggest thing that I've noticed is that, yes, I think that liposomal is second to IV. However, we have this powdered vitamin C that's most economical and will last quite a bit longer. And I want to make sure that we're not making it out so that it's the lesser than, because it isn't. It's actually what we started with. So when I speak about it, I'm like, this is the vitamin C that I used to package as a child. It's, just as good. It's just a different delivery. It's I don't get into the external cell, but the biggest thing that I'm hearing is this one's going to cause you GI trouble. And that's not true. This one is actually what you can use to titrate your dosing. It takes more doses through the day, but you can use it for a wide range of things where you can really maximize and get somebody 12,000 milligrams in a day for more than a month or two. Whereas if they go to liposomal, they're going to be out of the box 2 weeks. So my point is it is a great choice for vitamin C because it's so pure, because you can titrate the doses as you need to, and because you can go up and down based off your bowel tolerance. It can cause loose stools. So that's what I would say. And then wait for them to call you and say, it hurt my stomach. Okay, you can teach them to buffer it. Because if we keep saying, like, this is what might happen wrong, then that makes me not want to do it. I'll just give you a perfect example. When you suggest things to people, we're hypnotizing them with our words. These are spells, right? And subconsciously, the person's like, okay, never mind. So last night we go to dinner, and Eleanor's like, Mom, this is the place that I got food poisoning from, the green beans. And I'm like, I don't know if it was the green beans, Eleanor, but sure enough, what does she tell Tammy when her plate of ribs or whatever applies with the green beans? Guess how many green beans were on that plate? They were all there. She didn't touch them. And so I'm like, your words are very suggestive. So it's important that we give all of them equal footing, and you just explain the difference between the two.
When you say buffered, you mean just decrease the dose? Or?
Buffered means mixed with baking soda. So that's acid, and baking soda would be base. So you can put a 1-to-1, add a little baking
that
soda.
vitamin C, the difference is it's just pure vitamin C powder.
Ascorbic
No
acid.
fillers,
There's no fillers, there's no nothing. So why is it superior to a capsule or a tablet? Because it's pure. Because you don't have to wait for that binding to unravel and for you to digest the corn fiber and whatever is in those tablets.
And you can actually spin the GI into a positive. So if somebody has constipation, they'll automatically take the powdered vitamin
And
C.
if a patient asks how to dose it, on Google Drive, there is that titrating.
Yes.
I don't know what it's called, but just do vitamin C and you'll see it. There's
Cap
the bowel flush, and then there's also how to dose it if you're well or sick or.
Maybe
super
we
sick.
should include it if they buy it. I don't know. But they're
I usually
Even
do,
if it,
especially if they're like, I want to do the bowel flush. No,
Yeah.
I automatically give it to them. So just know that those are all.
and we've
there.
like made it into a paste too. Like you
I was
can
gonna
mix
say
it with
put it on
water
your
and put it on
skin.
burns too.
for burnt.
And it lasts really forever.
It does last forever. So the only other thing about the powder is if it's left open or it's browning or clumping, then it's becoming oxidized. So you want to just make sure they put it in a cool, dry place, and then it's not getting brown. And Courtney, my family loaded the last ones, and so the outside there's some browning. So you can just wash it off. And I'm sorry, we're fired. And it's
But
fine.
it's the same concept that we talked about in IV crash course, where like we don't say that this is just this. Everything has its purpose. Everything is powerful and effective for what it's meant for.
So
So our words matter the way we talk
it's just
about them.
important that we really keep educating about the dose is dependent on the fire. I say that all the time. And what I like about the powder is you have a lot of liberty, and you can change it as you need to. So that I just find that the liposomals are an unrealistic expectation to have someone on 3 and 5 grams of a liposomal. Like that's really expensive.
Yeah, they're going to go through that so quickly.
All right. Well,
Great for
we
transport.
are. Thank you. We're ready for NAD. Grab your pens and paper.
Am I in the TV?
Yes.
Am I too far? Yeah, no, you can see.
Sure. Log into your computer. Just log into your computer.
Do we all
You
fit?
can sit over here. Look,
Yeah.
Oh, Daisy's coming too.
I just need to share.
Daisy, will you turn that beeper off? What is that? It's our scale, it's meter?
Is it the?
Just unplug it.
Oh, it's the face pen, skin pen. Okay, guys, I'm so excited. This is one of my favorite topics. Hey, Daisy. Hey. All right, so I'm going to start. So, NAD. I do not expect you to know what NAD stands for, but you are going to be asked. so you might want to learn it. NAD stands for nicotinamide adenine dinucleotide. And it is a coenzyme or cofactor that allows us to make energy, make an ATP molecule, heal the brain, improve longevity or anti-aging, and helps with addiction and get people off drugs and alcohol. It reduces cravings. So it's a cofactor or an enzyme. And what I tell people is it's like the gas to your car. So you have all these cells, and what NAD does is it helps to produce ATP in the mitochondria. What is a mitochondria? It's a battery. It's our battery pack in all of our cells, and we have multiple mitochondria, most focused in the heart and in the brain. And I think you guys know that with the medicine we practice is cellular medicine, so everything boils down to what's going on inside the cell or what's getting kicked outside the cell, like is the trash being taken out? Is the cell dying when it's supposed to? Is it communicating with other cells? So everything is cellular medicine. And when it comes to longevity, when it comes to fatigue, when it comes to brain disorders, it all boils down to what's going on with the mitochondria. Because if the mitochondria is not working, if you don't have any battery, think of your video game, you're out. And so the largest portion of people who come in here have fatigue. So they're really struggling with energy. And I'm bringing you just a little backstory is that NAD, it's been created, or they found out about it more than 100 years ago. Now, because it's a derivative of vitamin B3, so that's niacin. Who remembers what niacin, not Sunny, or Jennifer? Niacin is a B3, it's a B vitamin, and it's what has been historically used for heart disease and cholesterol. So people know about niacin, they know, oh, if I take a large dose of this, I can reduce my LDL, the bad cholesterol supposedly, and raise the HDL. The problem with niacin is it causes flushing. And so to take 2,000 milligrams on a prescription drug would be called niaspan. So they're on to us. And they give it to their cardiac patients, but what they don't realize is what they're doing is raising the NAD. So this derivative is from B3. Now, there are precursors to NAD called nicotinamide riboside and nicotinamide mononucleotide. So remember we said dinucleotide, mononucleotide. So these are the precursors that can also break down into NAD. And this is where the marketing and some of the pills and things that we're going to supply for patients, this is where we're going to have an impact. But similar to the vitamin C, when someone calls you and says, hey, I heard about NAD, I think it's great. Can I take this? What dose? How do I do it? The thing about the precursors is the same thing about oral vitamin C. They're destroyed in the stomach, and so that's what makes IV superior, and that's what makes the sub-Q superior, and that's what makes the sublingual NAD superior, right? Because everything we're about is about delivery. So let's get into the details of why and what I want you to say, right? So, because I think there's a lot of confusion based off, well, how do I answer?
So, for any questions on all that?
Okay, so the most important thing you need to know is that this coenzyme is involved in energy production for all our cells, okay? And one of the most awesome quotes I wrote says, the importance of a functioning mitochondria cannot be stressed enough. The word crucial is used a lot. And so it's crucial for our function. And at the end of the day, everything we talk about, whether it's diabetes, obesity, heart disease, cancer, is a metabolic disease. And if we're changing metabolism by increasing ATP, and ATP is one energy molecule, then we are changing their metabolism, we're changing their metabolic function, and we're helping them. Okay, so it's not talked about enough here, and I'll tell you why. So here's the backstory. So when I was younger, my dad and my brother went to Mexico to meet with a doctor named William Hitt. He was using IV NAD to get addicts off of their drug, whether it was alcohol, opiates, and within a week, these people didn't want their drug, they didn't care about it, but they were also elated, they felt great, and nobody really understood the dynamic. come the MEDIAs who are on the North Shore, who have brought NAD to America. They deserve credit. And she wrote a book. It's not great, but it still gives her history, and she does deserve a lot of credit. And so now, 7 years later, there are multiple pharmacies that are doing it. But we have the great fortune of the first pharmacy that's making it is Archway. So we're really lucky, y'all. We're in Louisiana. We're not ahead of a lot of things, and we've got this great pharmacy. So my dad and my brother went and learned with William Hitt how to use it. And so I knew it would be a part of our practice, but I didn't think it would be so quickly. But within the first year, the MEDIAs and I were in contact, and so we started using it. So when I first started talking about NAD, we just used it for addiction. Now here's how it works for addiction. It allows the neurotransmitters to communicate. And by doing that, it increases your dopamine by 6 times. Dopamine is what gives you your get up and go or your drive. So think dopamine, drive. Testosterone is also another big part of that. But this neurotransmitter is what they are lacking. For the alcoholic, they create aldehyde. Aldehyde combines and goes into where the dopamine is in the body. You don't need to know this part to tell patients, but for you to understand, that's why alcohol is so addictive. That's why these really smart people are like, how is this person still an alcoholic? It's a chemical bind. So they really are addicted to it chemically. So once we displace that aldehyde, we put the NAD, that's why they don't have the addiction anymore. They don't care about it, and they feel good. They're happy. And one of the new pieces that I picked up last night, just finishing studying, is that it raises oxytocin. And oxytocin is huge for social interactions, for feeling good, for feeling close to people. So I think that's the other thing, that when alcoholics, that's their disease is chemical, but there also becomes the social part of the disease. So that's the beauty, I think, of what we see. And if you guys have not experienced, when we treat an addict, there is a turnover that I can't explain. It's either on day 2 or 3. Sometimes with the opiates, it might be later. But you will watch the transition of this person, and it's a look in their eye, it's their face, it's their expression, and it is beautiful to watch this person completely flip over. So you'll see it if you haven't seen it yet. And the problem that I would say that we're having with NAD is that it's not finite. It's not something that I can say like vitamin D, load this is the number. They're working on that. But in the meantime, it is subjective, and it is similar to ADD. We don't have a test for ADD, but you can say, okay, now this child can sit still and take a class. So for NAD, what do we notice? What do our patients say? They say, I slept like a baby because NAD impacts circadian rhythm. I have clarity of mind. I just feel better overall, right? I can think more clearly. I have energy. I don't want my alcohol, right? Or I don't want the drug. So addiction, you got that down, right? So it helps increase, so what would you say? It helps increase dopamine. It takes away the cravings. Whatever is on is off. You don't have to white knuckle it. Those would be the words I would use.
Another big thing that we've found is it significantly reduces their withdrawal symptoms.
Yes. So that's the cravings and the withdrawal. So for alcohol, like when they go to an inpatient facility, I think that everybody should have NAD at least a week before they go inpatient, because they say it takes a year physically for that person after they've gone through an inpatient and then detox for them to really be able to receive and open up and be physically better. I think this fast forwards this. We've seen it. It just basically opens their mindset. Same. So it allows them to really be receptive to what they're learning, and then whatever program they choose, whether it's AA or any other of the programs that are supportive, they can really engage in and get the most out. So it's an open door, an open window, physically, chemically, but we can't make them do that other behavior. So where we've not been able to, I would say, do our best because we don't have the counseling. We don't have that psychiatric part and that programming here, but we're the medical part. So we're going to open the door, but they have to take the action. So again, the onus is back on the patient.
But if you ever need any suggestions as to where they can go after this treatment, just let me know. I usually sit down with the patient and talk about meetings and outpatient treatments and things like that. And it was told to me once that if you do the NAD therapy, it will catapult you into where I was in an inpatient facility at 60 days. And then so I was in there for 90 days. the treatment, the 10-day treatment would have put me at 60 days in the facility. And then the last 30 days is just putting my life back together, basically.
I mean, does that make sense? Because those first few days, they're just in disbelief. And what you need to know is when they go into an inpatient facility, especially for alcohol, they snow them. And so they basically knock you out.
Yeah.
So here you are, just a drinker, and now you've got all these other meds on board. That liver's congested. You're not really able to metabolize all that. So that's 2-3 weeks that we could eliminate. Anyway, okay, so that's the addiction part. And I will say that we don't see that quite as much because we don't promote it as much because we kind of have been pushing that to Springfield. So now let's enter into
Springfield is the menu.
Springfield is Dr. Medier's place, yeah.
They only treat.
And that's all they do. They have 11 chairs, and that's all they do. And they sit and hold their hand and take care of them very well. And I'm grateful. Now, if we have somebody that's our patient that wants to stay up here, we can do the same. But we're promoting now the other parts that I think are going to be so much more widely known very shortly. Now, we talked about what NAD was. Let's get into the other people who would get it. So if NAD is crucial for mitochondrial function and it helps to increase ATP, which is one energy molecule, raise your hand if you've heard of the Krebs cycle. Krebs cycle. So I want you at some point to pull it up on your phone. What's the Krebs cycle? And look at how many times you need NAD as a coenzyme to make ATP. It's quite often. So, of course, the number one complaint here is fatigue. And so, of course, I think that everybody should have NAD. And so what you need to know is by the time we're 40 years old, we're down about 50% of the NAD that we make. And by the time we're 40, we're down 50%
Of ATP.
of NAD.
As compared to what?
As compared to when you're in your 20s and 30s. When you start aging in the 30s is when it starts going downhill. So when you're 80, no, excuse me, when you're 60, you're down 80%.
This is just a natural part of the aging process.
This is part of what they think is the aging process.
Right.
Yeah, so all these other disease, this is the first phase of aging is the decline in NAD. Does that make sense? And it goes back to, in our talks, like the things that we are really focused on for our patients. Why isn't someone well? There's only 2 or 3 reasons. It's cell-to-cell communication. Either they are lacking the nutrient or the nutrient can't get into the body. They're not absorbing it properly, right? They are toxic and the nutrient is blocked, right? So toxins, nutrition, Allie, what's my third? Hormones, thank you. And the hormones are blocked by the toxins. And so again, it's all about nutrients. It's about getting it in. So if we can increase the metabolic rate, we can detox, right? So they say that NAD is crucial and helpful for liver function, and so it's helping to clear the fat from the liver. So it's impactful in all of your cells. So back to the energy. The way it does it is it increases ATP. So when you're telling someone if they sound tired, you might suggest that they try that sublingual. Or you could suggest that they try either nicotinamide riboside or NMN. And Megan, I'll get with you about which ones we should probably start supplying again because it's growing in popularity. So now they're doing longevity studies and they're doing human studies to prove that this does raise your NAD level. But I'm always going to defer back to the IV because this is a whisper and treated the same as you would oral vitamin C. There's a massive difference between what you can take orally and what you can get accomplished with IV, right? So the dose for the NR, NMN, same thing, 50 to 500 milligrams and max of 2,000 milligrams a day. And have them take it for 4 to 6 weeks and make a judgment after that. And what they're looking for is energy, better sleep, feeling better overall, losing weight.
I mean, Doc, correct me if I'm wrong. I've never read anything about like an overdose on NAD too.
Yeah. No.
Have you heard about the patch?
Yes. So the patch is prescription, and I have taken it. It doesn't do jack. No, it doesn't. I've really gone through the inhale. Remember I was telling you about Ray Solano was a pharmacist. When I first started, we did an inhale. Imagine that's really difficult. We've got cocaine addicts. We're like, oh, you're triggering me, right? So with the inhale, it burned the hell out of your nose. And then we tried, the sublingual I have personally used and seen benefit from. And obviously the sub-Q would be the best. So in our practice where we could grow, we could start telling more people about NAD. We could start ordering sub-Q for them and then have it delivered to the house, but obviously charge sort of a visit fee. We could definitely talk about that. I think we could get a lot of progress with people loading it sub-Q. I have a lot more people on it. The side effect, I've got to tell them to go to coffee shop. Okay. You just stop.
And is the sub-Q supposed to burn?
The sub-Q doesn't burn, but what you will notice is the side effect profile. What, like in IV, the big side effects is chest heaviness and pressure, shortness of breath, and feeling like dead leg, and sometimes nausea. You'll notice it if you overdose on the sub-Q. And that is why I use it, because it's the only one that I'm like, oh yeah, I feel the same side effect. I know I've gotten the level up enough. Does that make sense? So I feel very comfortable. So
And now it feels horrible, so you know you've got good
well,
stuff.
that's a really important part.
Yeah.
You have a person coming in today who had a bad reaction to something and say, no, you're touching, you just scratched the surface. You got it. That's actually where you want to be. Okay, so now let's talk about brain healing, since this is a big one for our patients. It's not only used for Alzheimer's, Parkinson's, for now traumatic brain injury, concussion, sleepy dreams, anxiety, PTSD. That's all still part of the brain. And so because back to the neurotransmitters, you're rebalancing that, you're making it so they can communicate. But it also has an impact at the nerve and helps to regrow those nerves. So you're specifically there at the myelin sheath again about metabolism. Okay, so when someone's asking you, what does it do? Who is it for? Addiction, brain injury, or brain healing. So that also applies to the hurt and the non-hurt. So what about executive function? What about the Scott Wilsons? What about the people like Ben Butler? They just want to think quicker. They just want to be sharper. They don't want to age. Okay, so that leads me into the next one, longevity. So not only does it help to create energy, but it helps to repair cells. And this is where this crucial part is, that it's involved in cellular repair and regeneration. And so without that, think about it, we will age multiple times faster, because if we can't heal the cells that are not forming properly, right? And then also, because of cell signaling, it helps to tell those other cells, hey, it's time to die, it's time to apoptosis and kill yourself and get rid of yourself. So without, I'm not looking at you, sorry. I wouldn't just noticed. I keep on looking at everybody else.
I look at him every day.
Apoptosis?
No. Apparently, we've been saying it wrong our whole lives.
So,
Apoptosis.
Calliope, Callia, whatever.
Blew my mind.
I would like to hear it on Google Speak. Okay, so
We trust Google with everything.
I love Google. They're my favorite savior.
Say it one more time, because I'm always struggling.
Apoptosis. But don't say it like that, because it sounds so crazy. But apparently that's right. Sorry.
That's right. So it's anti-aging, and so now let me tell you the story. David Sinclair is someone you will read about when you read about NAD. He's involved at Harvard or MIT, and they did a study on mice, and they took a biopsy of their muscle, and they had a mouse that was 2 years old. They gave him NAD, loaded the levels. When they re-biopsied the muscle, it looked like a 2-month-old. So the amount of mitochondria, so it grows new mitochondria, it repairs the broken mitochondria. Big deal. So that's why it's in the anti-aging world. The other two things that we didn't talk about for brain healing and then longevity, I guess, is back to the executive function, anxiety, depression, PTSD, just anything going on with the brain, y'all. Traumatic brain injury. Yes. Anything that belongs with cellular metabolism.
When you think of cellular, so I'm picturing cellular communication, certain cells, neurons release neurotransmitters or molecules, and then they have to be picked up by other cells. So you've heard of like SSRIs, right? There are receptors on the other cells with other neurotransmitters that basically like the ears. So this one cell can be screaming, and the other guy's got to have his ears open to hear it. And a lot of times in MS, because there's no myelin sheath, or in all these different things, for various reasons, the guy with the ears is not listening. The ears are closed off. And so that's that cell-to-cell communication. So maybe the cell is spitting out these neurotransmitters, screaming, hey, I need you to absorb this dopamine, you got to do stuff here. And the guy with the ears can't hear it. And so that's when she says cell-to-cell communication, it's allowing the body to do what it's supposed to do, right? Allowing the body to function optimally and eliminating the things that are getting in the way. So it's allowing that cell to talk to that other cell. And sometimes it's the guy with the ears, and sometimes it's the guy yelling. Like sometimes he can't get the cells out for some reason. The membrane is not releasing the neurotransmitters. So in some way or another, it's improving that cell-to-cell communication because your body knows what to do. We just have to help it get there. That's what the NAD does.
It helps me, because I'm not medical, to think that like, that's all I am is cells, just contained within my skin. And if they're not communicating with one another, then it becomes dis-ease. I forget that.
No, that's true.
Totally.
And back to we're made of energy, right? So if this cell-to-cell conduction has to skip a cell, we got a traffic jam. Okay. I want to talk about just a few of the other things that it can help. I didn't put it up here, but chronic disease. If it's about metabolism and it has to do with cell communication, it has a massive impact on patients with diabetes, obesity. Diabetes specifically, one of the doctors at the first conference said he had to take his wife off of it because she's losing too much weight. Wow. So it helps with insulin resistance. So it helps with obesity because of that.
Of course it does, because insulin resistance is a cell-to-cell communication issue.
Yep. So it helps with heart disease. It helps with coronary artery disease. It helps with congestive heart failure. There's another story. When I first started using it, really reached out to a network of doctors because we were very few. And the one doctor said she had a patient who had heart failure and such a terrible EF and had so many MIs that they basically said, goodbye, thank you, go to hospice, have fun. And he said, okay, he packed his bags, his family was willing to let him die. And as a last-ditch effort, they gave him NAD. So much so that none of the EKG, it all repaired, it all recovered. Couldn't tell that he had a heart attack. And so it does reverse time in a sense. And so you hear these stories, it definitely invigorates you. But it's not definitive for every person. So where the biggest issue is in medicine and why it's not being used, it's not FDA approved. It never will be because it's a vitamin. You can't patent that nature. So if they mix it with something, perhaps. But that's why it's helping with these chronic diseases. Okay, so if you see somebody who we're not getting well, you think, okay, you might be a candidate. So now we talked about what, we talked about who, we talked about when. So you guys are not going to make the decision of how long the person needs NAD for. The standard dosing that Sunny's going to go over is 5 and 10 days, but we've changed that up a little bit to allow more people to have it. And this is the part that we'll come back to this, and maybe giving some people sub-Q so we can let more people feel it. We talked about the how, so it increases ATP, it increases communication, it improves DNA repair, and that's how it's keeping you from dying because you know that DNA, look at this stat, 10 times. Every day you lose like 10 times the amount of your DNA. You're unraveling, basically. And so the word to use is telomeres. So in the longevity world, someone might call you and say, I want to know, does it help my telomeres? Telomeres are like the end of the DNA, and they call it like the shoestring. You know, when that little plastic falls off and it gets frayed. So the telomeres can keep lengthening and can be healed and protected with NAD, which will reduce your aging. Does that make sense? Okay. Who, what, when, how?
You will see telomere health being talked about in the news. It's already
It's getting
happening.
hot.
They're like the end caps protecting your DNA. So if you can lengthen them and strengthen them, you're going to protect the DNA for longer. People are really starting to talk about telomere health.
So the final piece is, what is blocking us from getting NAD? How are we reducing our NAD? Like, why is this happening? That is because of our diet. It is because of our lack of exercise, and it's because of the toxins. So either the gut is a wreck and they're not absorbing what they're taking, they're eating it, but they're not getting it, or they're not taking it in, or they're destroying their body with these other things like alcohol, or, you know, fatty liver from the alcohol, or fatty liver from the sugar, or, you know, toxins.
And isn't there like a group of individuals that cannot even produce it or absorb it?
I think that a quarter of the population has a genetic mutation that your mom and you and everybody has, it pass it along. And I honestly think that those are the people that when they take it, they're like, wow.
Yeah.
Those are the ones you can probably guarantee if we did a genetic test on them that they probably have that deficiency. So you can read about its NAD deficiency, that they start off with it, right? There's a time.
But we're not able to test for that right now.
Not yet. And then the foods that are, so how do you raise your NAD levels? Of course, we'll go the other way. IV, sub-Q, sublingual, precursors, fasting, caloric restriction raises NAD, exercise, and foods that are high in niacin or B3. So that's liver. liver. So I'm going to start pushing liver, and I think you guys remember when I started Daisy on the organ meat complex, she was just like, feels so good. It's the liver.
So a lot of people on that.
If people can eat liver, have them eat liver at least 2 or 3 times a week. If they can't eat liver, then ask them to take these supplements. Beef, chicken, tuna, turkey, salmon, anchovies, pork, avocado, peanuts. You can see where I'm going. So back to the meat that everybody is afraid of, obviously organic and grass-fed and wild, but we can change our NAD levels by changing our diet. The only thing we've not talked about is the redox reaction and the antioxidant, and then I'm going to give Sunny the floor.
Yeah.
So redox, you're never going to get away from it. Think about the taxi cab. The light is on. It's ready to receive and serve. That's NAD. And then the one, that taxi cab that's already full, that's NADP. And so it has to do with the hydrogen molecule, has to do with it giving electrons, taking electrons, reducing free radicals. So in a redox reaction, vitamin C does it, ASEA does it, NAD does it. You're reducing damage to the cell, allowing it to live longer and do its job. Reducing oxidative stress. And that's another piece of why coronary artery disease. So to recap, NAD is a derivative of vitamin B3, which is crucial in energy production. It is very helpful in cell repair, longevity, anti-aging, chronic disease, and brain function. It's for people who are tired, people who want executive function, traumatic brain injury, Alzheimer's, Parkinson's, stress, PTSD, alcoholic, opiate use, athletes, want to recover, their endurance. It's pretty much everybody. It's basically the liquid gold that we're trying to get to, and we do all these other maneuvers. Because the goal is to make more energy. If we have more energy, then we can repair and do these things that we need to do. So, any questions? You've got the dosing on the precursors 50 to 250. They usually come in 200 or 300 for per 2 pills. If the person wants to push it, they can go all the way to 1,000, but they should titrate up. They should notice an effect in about 4 weeks. It's nothing compared to the real deal.
I was just saying, do you think it'll become more affordable as time goes by?
Yes.
Is it something that
It already is. So here's an example. Right now, we've been using, so I'll tell them, we've been using Archway for the sub-Q. It ends up costing the person almost $250. The pharmacist who used to run Archway left and created his own called Galleria, which is around the block, and his is $80. So much more affordable. Now, I can't say whether or not that's the same or better. I don't know. And in some of these other productions, they have heavy metal toxins in them. So I'm still a fan of Archway.
Has anybody used Galleria?
The Zelenkas use it. That's the only reason I even know about it. And I've asked, who contacted them? I need Christian Hahn. We need a salesperson from there. I need them to court me. Court.
Dinner.
Yeah, so I think that could be a great segue for us to have a visit. Then we order it, we pay for it, but they pay us. That makes sense. And now we're the NAD provider for sub-Q.
Yeah, the Archway is $259, and then it's like $25 on top of with shipping.
Questions?
Let me run through this.
Yeah, I mean,
Run through in 5 minutes. Go ahead.
Totally offline, we can take it, but I'm just wondering NAD and cancer for this.
Okay, that was the only other thing I didn't mention. There are 2 new articles out about breast cancer specifically, and yes, absolutely, it helps to improve cancers. In the early days, I was reading stuff that maybe it was going to be harmful and be dangerous, and now it's coming out more and more. This is going to blow up. You guys are on a very early phase, and obviously we've been doing it a while, and there was nothing out there, nothing. There was no one. Remember, I told you I went to this conference, searching, and so it's great because the other people doing the marketing for us. It's really important that we know to talk about it and bring it up. And you know, because Barbara is quitting doing IV to the NAD sublingual, which is a joke, but she'll feel it. She'll watch.
All right. Okay. Thank you so much.
Thanks. All right, I'm gonna run through this page in 5 minutes.
Good
We're gonna
job,
go 4 minutes. I gave everybody a copy.
Okay, everybody has.
All right, so that's the fun part of NAD. This is the logistics part of NAD. Okay. Yeah. All right, so I'm gonna run through this, and then if any questions, shoot them. Also, phone script. We are.
I have 2. I have 1. I got it.
So phone script, we're working on that. That should be coming out soon. Our website has a bunch of articles on NAD, various diseases and conditions it can help with. I often say, hey, you can research about it more. We can talk when we want to do a follow-up call or whatever. That's a great resource. I shared with each of you 2 documents. The first one, the Google Doc. This is kind of like the main document that has all the history of NAD, how it helps, all the protocols for NAD, benzos, alcohol, anxiety, all the different protocols, like down to a T. And Cheryl was a big part of making that. Thanks, Cheryl. So anytime you ever have a question about NAD, refer to that document. The NAD intake appointment is $500. It's non-refundable. This is all written in the NAD consent form too, which I'll get to in a second. $500 non-refundable. If they choose not to do NAD, cost still applies. If they choose to do NAD IV, it has to be more than 3 days. If it is, then that cost of the $500 goes toward their the total price that they pay. Does that make sense?
Yep.
Yes.
Okay. And then let's see where it is. So let's say a person comes in for their intake, they pay that $500, and they say they're going to do 10 days of NAD. Half of that 10 days of NAD is due on that first day, and then the other half is due before or by the end of that first day.
What, we can talk about it, but when they balk and say they can't do it, it's like, then we can't order this.
Yeah.
They have to be paid to order this because it's expensive.
And then once we have that interaction, then they have to do it within 30 days. They can't do it like a year later.
Okay, let me correct that. So $500 for the intake is paid at the intake. They meet with the provider. When they walk out, they've decided, yes, I'm going to go forward with it. Half of the treatment is due right then, because that's when we're going to order it and they're setting up. And then we're putting them on the schedule and we're scheduling them for the intake.
If they
And
don't,
then-
if they don't pay right there, then you wait.
Stuff with
Yeah,
it. You don't
we
do
wait
it,
till we
it
order. And
expires.
yeah,
Yes.
so then that first day of treatment, they're signing consent forms and we're taking the second half of that payment. Okay?
So this part we can discuss. So if IV NAD, the 500 intake is required. If they want non-IV NAD, like sub-Q, I put down here they can have a $50 wellness visit. We can change that in the future if we need to. We'll take that offline.
No, I think you just leave it and order them to sub-Q and then we pay
But
for that.
the question
No,
is
the 50,
$50.
I mean, let's say they just want sub-Q. We'll talk about that after. But for now, we'll leave it $50 wellness visit. If you guys are unsure, a lot of times like we'll get a patient from one of Dr. Mary's patients that we kind of transition into NAD. So that part, it's not always black and white. So if you have any questions about that, just grab me or Courtney, and we can kind of take it from there. The most important part when you're ringing up somebody with NAD is documenting everything in the communication log. And then at the intake visit appointment, their consents. So they fill out their normal 3, and then there's 2 NAD consents: NAD payment consent, NAD just a normal NAD consent. They get onboarded the same way. They'll have an intake visit with the provider, and that's where we kind of go into their full history. Daisy, we can make some templates that we can use for that, and then we'll go through the benefits, the amount, the length. It's not decided by the patient, it's decided by the provider. And then what I typically do right after this is the provider or the nurse can do it, but once we get that payment, we have to call Archway and make sure that we order the NAD. And I wrote down kind of what I say to them right there. Really important to say bill and ship to clinic. Okay. Any questions about that?
If you guys haven't read the consent that I usually sit down with them and go over, it talks about like lunch and
On the back of this paper, there's a checklist of everything needs to be done.
Yeah.
So,
so you might want to just kind of take a look at that. I should have printed it out today for this.
So then that first intake appointment is really important because that's kind of where you get all your ducks in a row. So that front office staff is when you make the appointments to Dr. Crono. You have to do them individually per day. There's no way to kind of do like a 10-day appointment.
Who does the NAD intake? Just you?
Just me or Daisy. Yeah.
You.
And then of course go over like what time to arrive. Usually, like sometimes I'll say come at 8:45 just to make sure you're okay with the nurse or the provider, but which clinic is important. And then this is also important. So in that Google Doc I shared with you guys, in each protocol, there's a list of what questionnaires need to be filled out, and that's either the PA, nurse, but if there is no nurse, then it's the PA. But it's clearly written what questionnaire needs to be filled out per day. And that's basically to establish a baseline, keep checking up on them, and how their symptoms are responding. Labs, so we can take this offline too. I put 5 days or more of NAD. We'll order labs. It's always at the discretion of the provider because sometimes I have patients that just got like a full panel from, let's say, another integrative doctor. At that point, I wouldn't order labs. But if they are getting labs, we use a place called ACU. Their labs in Metairie. And there's an ACU lab requisition I brought. Does anybody, Daisy, do you know how to fill this up? Okay, so I'm gonna quickly show you. This is a Acu lab rec, and I highlighted what needs to be filled out. So basically, their name, their date of birth, right, male, female, and then one of the most important parts is here. It's gonna put bill patient or bill client. When you're doing this NAD lab rec, it's important to select a bill client. They're gonna charge the remedy route because I'll explain this in a second. We're gonna charge them cash price for the labs. Okay.
We can fill one out and have it be the example, and we'll put it inside.
Yeah, we can do that. And then here you would just put ICD-10 codes, and then the main test is this basic panel. It's called, and it's just it includes a bunch of different labs: CBC, CMP, vitamin D, thyroid, B12. And
Can I ask a question? So the ICD-10 code is, I know that we've gotten into some kind of trouble with like filling out.
It's not as important because
do you
it's
do
cash pay.
addiction? You know, because that follows this patient around.
No, I mean you can even just do symptoms because the ICD-10 is not as important because we're not billing insurance. Yeah, fatigue, insomnia, anxiety, it's just very generic stuff, but it doesn't matter because we're not billing insurance really. So.
And I'm going to tag onto that just so you guys know, we have not had anybody with liver enzymes over 100 or so, but this is imperative in helping them heal their liver. So when they stop the alcohol, obviously that does a great trick, but this is actually there in healing the cells. So it'll bring their liver enzymes back to normal. So I can't think of one person who would not qualify for NAD, even if they were in renal failure, which of course they're going to not come in here like that. Yeah. But they're really, because the question is who doesn't get NAD? Maybe
it's like kidney or heart failure, pretty much, yeah.
I can't think of one person who couldn't.
So basically, what we're going to do, so the labs that we charge the patient $80 for these labs, right? We charge them, and then Acu is going to send us the bill. So that's why it's that bill client's important. Okay. And that's an additional cost. You ring it up separately. We can show you how to do that later. The last page of that Google document that I sent is a discharge plan. So basically what I do is I print that off and I review it with the patient before they leave. It has a list of supplements that we recommend, but of course if I get labs and I just adjust it accordingly. And then Daisy or even the nurses can help with this. I always call in a prescription of NAD for them. Going back to the sub-Q that Dr. Mary was mentioning, that's kind of my go-to. The only reason I wouldn't do it is if the patient's like, hey, I can't stick myself. It's a baby needle. It's like a TB test if you guys have ever had that right under the skin. But I call in the prescription, and you can, sometimes I'll get on the phone with the pharmacist, Daisy or Caroline, and just say, hey, if I can't do sub-Q, I'll do sublingual at that point, and then just talk about the dosing with the pharmacist. And they're really good about talking about options. I put the ball in their court. They call the patient, they set up billing, they ship it to them, they explain how to give the injections, all that stuff. So our job is just to call in a prescription.
And that might change slightly.
And then I also say provide needles as well. So yeah, they're very good about it. So the back of this page is simply a checklist of all that needs to be done. And I kind of assign who's responsible for what. So consent, front office when they check in, intake visit, of course, PA. Lab requisition can be anybody. At some point, hopefully everybody will know how to do this. Ordering NAD between the nurse or the PA. Ordering NAD for home, that's me or Daisy. Scheduling the appointments, front office. Questionnaires, nurse. The money is front office, and just make sure the document, discharge plan, PA. How was that time?
Yeah, very important to document the money part of it too, because that gets super confusing. Sunny and I are always like going back and forth, like letting you know, saying like, what is this? What is that? So just make sure you guys put that appointment note and in the communication log when you take the money for it. This patient's paid half plus the $500 deposit. Blah 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 blah.
Okay, so that New Orleans can get there. I'm just gonna give the floor to Dr. Mary for 1 minute, and then we will wrap up.
So I just want to have a quiz.
Yeah. What do you mean? I thought you had a question you wanted to ask them.
No, I want to have a quiz.
Oh, on NAD?
Yeah. Caroline, name 3 reasons why someone would come in for NAD, or 3 people you could identify you would give them NAD.
Okay, energy, addiction, Alzheimer's.
Jennifer, what vitamin is 73?
What, I can't sleep, what do you have that can help me?
What 3 things? What 3 things reduce free radical damage that we offer around your room?
Vitamin C.
NAD.
And
And
Hey, the one thing I wanted to say about it is it's a commitment. Because it's either 3 or 5 days and it's
So
multiple
it's time
hours and
commitment
it's
and
the
then money.
time that it takes depending on how you can.
So do employees get a
So-
discount?
Yes.
yes, they do.
So try taking it down right there. So that's the only other thing we're gonna talk about.
Okay,
So
Around one
it
vial
is
is
or
like
the NRI,
19.
which is the tonight.
So one vial. One vial.
So,
and
the
then
only
we're
other-
doing 2 vials a day.
Okay. The only other thing that I'm just gonna tell you, and this is how I know that my friend Devin is a copycat, because no one else is doing this. So it's like, when you make something up and then they start doing it, it's like, how'd you know how to do that? I was so tired of hearing from people, even like Danny, they have more money than anything, but guess what's your most valuable asset?
Uh-huh.
Hey guys,
And so I am
I'm
friends
for
with
Danny.
James Claymont, who is doing the longevity studies on people who are over 100 years old centenarians. And the way they're doing it in Portland, Idaho, is they give them 250 to 500 milligrams once a week. So like Miss Barbara, you can say, okay, you can't sit, fine, it means 2 steps forward, 1 step back. We're gonna give you a little bit less, more frequently. Does that make sense? So you can give them 250, problem is the vial really should be right away.
You can.
So it's
Roy Orbison.
and it just turn a little bit. I'm not used to it.
Yeah,
That's
right.
Instead of trying to do it in the tummy, just trying to get the fat.
Yeah.
Just do it.
Okay.
Okay, guys.
How's my hair?
She's set us a message. Okay, 10 seconds. Go.
Come on, get it. Get it.
No, y'all are
Two.
stop.
One.
Wait, no, Sunny.
Okay, we're gonna do
They're
another.
not saying that, just-
We were all like this. 10 seconds. Go.
Yeah, this side.
Nice.
Wait, is Daisy, you're in it?
Yep.
Yeah, move a little closer.
Go team.
There.
Wait, can you check and see if everybody's eyeballs are open?
Yeah.
And can you come a little closer?
Doug was fussing at me about new Bible.
Open up. Guys, that is gorgeous.
Quit laughing. This is cherry.
Yeah.
Well, we can move it forward.
You'll have to, so the 2 legs and straight laugh. Okay, one more, a little closer. 10 seconds, go. Go closer.
Yeah.
Go to the screen, go to the screen.
3, 2. There we go.
Wait, she was like here.
I know.
I know, we're gonna take
Photoshop.
her.
Photoshop her.
It counts. Oh, look at that.
Wait, I'm jumping over.
Do it again. No, that's nice. Oh.
Did you take my notes already?
Yes, I did.
Okay.
Yeah, baby jump. Okay. All right, let's go. All right, they're not the best, but guys, does anyone know where my name comes from? I don't know, but I have mine.
That's a good one.
Thank you. Yeah, I'm almost interested. Yeah. I should have washed my hair.
Come on.